to the We Serve Canada's Community e-Talk with our very special episode 11 for our series Youth and Mental Health. My name is Anu Srivastava and I'm the Executive Director of We Serve Canada, which is a Canadian federal not-for-profit organization. It was established with a vision to promote health and wellness, to create improved lifestyles, education, and need-based programs for youth, women, and children. These programs focus on community development, civic engagement, and workforce integration, arts, culture, and heritage to showcase our diverse diaspora cultures, and also humanitarian and international causes. We started this online initiative to create a safe space for viewers to listen, discuss, and learn about mental health together. We received such a positive response for the series and have decided to host this very special 11th episode, which is dedicated to our viewers who have experienced, recovered, or know someone who is struggling with drug addiction. At this time, I would like to invite a very special guest onto the show to discuss the rising issue that is currently occurring in Punjab in India. Please welcome Reet Banga. She is an immigration consultant working at RKB Immigration, who is a true altruist and upholds the view that one should always work for the betterment of the society. Welcome, Reet, to the show.
He was my only son, and I had started wishing that he would die. And now I cry the whole night with his photograph in my hand. Says Lakshmi Devi, who lost her 25-year-old son to heroin overdose. Drug addiction has skyrocketed over the past 2 decades and has negatively affected every aspect of life in Punjab. According to the United Nations Office on Drug and Crime, the state has become a destination as well as a transit point for global opiate drug smuggling and dealage. It is astonishing how widespread the problem is. One estimate says that more than 2/3 of Punjab's households have at least one addict in the family. The youth unemployment rate in Punjab is also alarmingly high at 21.6%. Health officials say the state needs to open more rehab centers for addicts as there are too few existing ones. While there are 90 private rehab centers, there are only 50 that are run by the government. Families in rural areas are either not aware of the rehab centers in the communities, do not have the access, or choose not to seek help due to the stigma associated with drugs. Even if they were to seek help, the state of most rehab facilities is saddening. Punjab deserves better. The youth deserves better. Our hope with this community talk today is to raise awareness about the drug issue by getting our community to address what's going on and to destigmatize mental health as a taboo. This is our one step for the youth and their families stuck in such vicious cycle of using, abusing, facilitating, and moving these ticking time bombs in the name of fun. I will now pass it back to Anu to continue the show. Thank you,
Reet, for giving our viewers an insight on the issue of our topic. You mentioned a very important factor that may be leading youths to resort to drug usage, which is a high unemployment rate. Not being able to find a job to support their families can be a huge stressor, and it really places a big pressure on their lives. Long-term chronic stress can be very harmful to a person's mental health and overall well-being. In our previous episodes on the show, we have discussed the effects of stress on mental illnesses and its relationship with drug addiction. People who are overwhelmed with stress and experience a mental illness may use substances in a risky way to help them cope up with the various symptoms of their illnesses. It is so important to determine the causes that are leading the youths to resort to the drug usage. guide them onto the road of recovery. We must empower and encourage our youths to seek help and receive treatment to regain control of their lives again. I actually think that by now, our audience has got a good understanding of the correlation between the stress and the drug usage and how these two elements can negatively impact a person's life. We Serve Canada is honored to have connected with an individual who has firsthand experienced the long-lasting effects of drug addiction. He has sent in a video to share his personal stories of battling this obstacle in his life. We please ask you to listen and reflect upon his story.
ਸਮਝਾ ਰਿਹਾ ਵੀ ਮੈਂ ਕਿਵੇਂ ਨਸ਼ੇ 'ਚ ਪੈ ਗਿਆ ਤੇ ਅੱਜ ਦਾ ਦਿਨ ਕਿਵੇਂ ਨਸ਼ੇ ਤੋਂ ਦੂਰ ਆ। ਠੀਕ ਹੈ ਜੀ। ਨਸ਼ਾ ਦੋਸਤੋ ਇੱਕ ਬਿਮਾਰੀ ਹੈ ਜੋ ਕਿ ਮੈਨੂੰ ਪਤਾ ਨਹੀਂ ਸੀ ਤੇ ਕਾਉਂਸਲਿੰਗ ਦੇ ਥਰੂ ਮੈਨੂੰ ਪਤਾ ਲੱਗਿਆ ਵੀ ਇਹ ਇੱਕ ਬਿਮਾਰੀ ਹੈ। ਨਸ਼ੇ ਦੇ ਦੌਰਾਨ ਮੈਂ ਜਿਵੇਂ ਨਸ਼ੇ 'ਚ ਮੈਂ ਪਿਆ ਇੱਦਾਂ ਵੀ ਮੈਨੂੰ ਫਰਸਟ੍ਰੇਸ਼ਨ ਹੁੰਦੀ ਸੀ ਵੀ ਮੇਰੀ ਪੜ੍ਹਾਈ ਠੀਕ ਨਹੀਂ ਹੋਈ, ਬਾਅਦ 'ਚੋਂ ਜੋਬ ਨੂੰ ਲੈ ਕੇ। ਠੀਕ ਹੈ ਜੀ। ਤੇ ਜਦੋਂ ਮੈਂ ਇਹਦੇ 'ਚ ਫਰਸਟ੍ਰੇਟ ਹੋਣ ਲੱਗ ਪਿਆ ਤੇ ਨਾਲ ਦੋਸਤ ਯਾਰ ਜਿਹੜੇ ਹੁੰਦੇ ਸੀਗੇ ਉਹਨਾਂ ਵੱਲ ਦੇਖ ਕੇ ਵੀ ਹਾਂ ਵੀ ਉਹ ਕਿਵੇਂ ਸਹੀ ਹੈ ਨਾ, ਉਹਨਾਂ ਕੋਲ ਵੀ ਜੋਬ ਹੈ ਨਹੀਂ, ਪਤਾ ਲੱਗਿਆ ਵੀ ਉਹ ਨਸ਼ਾ ਕਰਦੇ ਆ ਨਾ, ਉਹਨਾਂ ਵੱਲ ਦੇਖ ਕੇ ਮੈਂ ਵੀ ਨਸ਼ੇ ਵੱਲ ਅਟਰੈਕਟ ਹੋ ਗਿਆ। ਤੇ ਸਟਾਰਟਿੰਗ ਮੇਰੀ ਇੱਦਾਂ ਹੋਈ ਵੀ ਪਹਿਲੀ ਵਾਰ ਨਸ਼ਾ ਕਰਿਆ ਤਾਂ ਮੈਨੂੰ ਬਹੁਤ ਮਜ਼ਾ ਆਇਆ, ਰਿਲੈਕਸ ਫੀਲ ਹੋਇਆ, ਕੋਈ ਬਰਡਨ ਨਹੀਂ ਸੀਗਾ ਮੇਰੇ ਸਿਰ 'ਤੇ। ਉਹ ਚੀਜ਼ ਜਦੋਂ ਵੀ ਮੈਂ ਕਰਨਾ ਨਾ ਮੈਨੂੰ ਬਹੁਤ ਰਿਲੈਕਸ ਫੀਲ ਹੋਣਾ, ਜਦ ਮੈਂ ਨਹੀਂ ਕਰਨਾ ਮੈਂ ਫਿਰ ਫਰਸਟ੍ਰੇਟ ਰਹਿਣਾ। ਮੇਰੇ ਮਨ ਦੇ ਵਿੱਚ ਉਹੀ ਗੱਲ ਬੈਠ ਗਈ ਵੀ ਹਾਂ ਵੀ ਕਿਵੇਂ ਜਾਬੀ ਨਸ਼ਾ ਕਰ ਲਓ ਬੰਦਾ ਰਿਲੈਕਸ ਹੋ ਜਾਂਦਾ ਹੈ, ਕੋਈ ਟੈਨਸ਼ਨ ਨਹੀਂ ਹੁੰਦੀ। ਉਹ ਪਹਿਲੇ ਤਾਂ ਮੇਰਾ ਸ਼ੌਂਕ ਦਾ ਪਾਰਟ ਸੀਗਾ ਵੀ ਮੈਂ ਕਦੇ ਕਦੇ ਕਰਨਾ, ਬਟ ਉਹ ਬਾਅਦ 'ਚੋਂ ਹੌਲੀ ਹੌਲੀ ਮੈਨੂੰ ਡੇਲੀ ਦੀ ਉਹਦੀ ਆਦਤ ਪੈ ਗਈ। ਅਤੇ ਆਦਤ ਇੱਦਾਂ ਪੈ ਗਈ ਵੀ ਹਾਂ ਵੀ ਜਦ ਡੇਲੀ ਕਰੀ ਜਾਣਾ ਮਨ ਐਨ ਰਿਲੈਕਸ ਰਹਿਣਾ, ਡੇਲੀ ਨਸ਼ਾ ਕਰੀ ਜਾਣਾ। ਉਹ ਤੋਂ ਬਾਅਦ ਪਤਾ ਨਹੀਂ ਉਹ ਕਦੋਂ ਮੇਰਾ ਜ਼ਰੂਰਤ ਦਾ ਪਾਰਟ ਬਣ ਗਿਆ ਵੀ ਹਾਂ ਵੀ ਮੈਨੂੰ ਡੇਲੀ ਬਸ ਨਸ਼ਾ ਚਾਹੀਦਾ ਹੀ ਚਾਹੀਦਾ ਹੈ ਵੀ ਹਾਂ ਵੀ ਜੋ ਮਰਜ਼ੀ ਹੋ ਜੇ, ਮੈਂ ਨਾ ਕੁਛ ਘਰ ਦਾ ਸੋਚਣਾ ਨਾ ਆਪਣੇ ਬਾਰੇ ਸੋਚਣਾ, ਇਹ ਹੁੰਦਾ ਸੀ ਵੀ ਮੈਨੂੰ ਨਸ਼ਾ ਚਾਹੀਦਾ। ਇਹਦੇ ਕਰਕੇ ਵੀ ਨਸ਼ਾ ਮੇਰੇ ਮਨ 'ਚ ਬੈਠ ਗਿਆ ਸੀਗਾ ਅਤੇ ਮੇਰੇ ਸਰੀਰ ਨੂੰ ਵੀ ਇੱਦਾਂ ਲੱਗ ਗਿਆ ਵੀ ਮੇਰੀ ਸਿਹਤ ਬਹੁਤ ਹੁੰਦੀ ਸੀਗੀ, ਮੇਰੀ ਸਿਹਤ ਘੱਟ ਗਈ, ਸੋਚਣ ਸਮਝਣ ਦੀ ਮੇਰੀ ਸ਼ਕਤੀ ਜਮੇ ਜ਼ੀਰੋ ਹੋ ਗਈ। ਨਾ ਮੈਂ ਕੋਈ ਜਗ੍ਹਾ ਦੇਖਣੀ, ਨਾ ਮੈਂ ਆਪਣੇ ਆਸੇ ਪਾਸੇ ਦੇ ਲੋਕ ਦੇਖਣੇ, ਬਸ ਮੈਨੂੰ ਨਸ਼ਾ ਚਾਹੀਦਾ ਹੁੰਦਾ ਸੀ। ਪਰ ਅੱਜ ਦੇ ਦਿਨ ਮੈਂ ਨਸ਼ੇ ਤੋਂ ਦੂਰ ਹਾਂ, ਜਿਸ ਦਾ ਕਾਰਨ ਹੈ ਕਾਉਂਸਲਿੰਗ ਬਹੁਤ ਜ਼ਿਆਦਾ ਹੈਲਪ ਕਰਦੀ ਹੈ। ਜ਼ਿਆਦਾਤਰ ਮੇਰੇ ਵਰਗੇ, ਮੈਂ ਆਪਣੇ ਹਿਸਾਬ ਨਾਲ ਦੱਸ ਰਿਹਾ ਵੀ ਮੇਰੇ ਵਰਗੇ ਜਿੰਨੇ ਵੀ ਨੌਜਵਾਨ ਹੈ ਉਹ ਸ਼ੇਅਰਿੰਗ ਨਹੀਂ ਕਰਦੇ ਹੈ, ਡਰਦੇ ਨੇ ਘਰਦਿਆਂ ਨਾਲ ਸ਼ੇਅਰ ਕਰਨ ਤੋਂ ਜਾਂ ਆਪਣੇ ਭਰਾ ਭੈਣ ਨਾਲ ਸ਼ੇਅਰ ਕਰਨ ਤੋਂ। ਠੀਕ ਹੈ ਜੀ। ਅਤੇ ਉਹ ਸ਼ੇਅਰਿੰਗ ਕਰਨੀ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ। ਕਾਉਂਸਲਿੰਗ ਨਾਲ ਬਹੁਤ ਹੈਲਪ ਮਿਲਦੀ। ਕਾਉਂਸਲਿੰਗ 'ਚ ਆਪਾਂ ਸ਼ੇਅਰਿੰਗ ਕਰਦੇ ਹਾਂ, ਤੁਹਾਨੂੰ ਫੀਡਬੈਕ ਦਿੱਤੀ ਜਾਂਦੀ ਵੀ ਅਗਰ ਤੁਸੀਂ ਇਹ ਚੀਜ਼ ਸਮਝ ਰਹਿੰਦੇ, ਤੁਸੀਂ ਕਿਸੇ ਨਾਲ ਗੱਲ ਕਰ ਲੈਂਦੇ ਤਾਂ ਤੁਹਾਡਾ ਹੱਲ ਨਿਕਲ ਸਕਦਾ ਸੀ। ਆਪਾਂ ਸ਼ੇਅਰਿੰਗ ਕਰਦੇ ਨਹੀਂ ਹਾਂ, ਉਹੀ ਚੀਜ਼ ਸਾਡੇ ਮਨ 'ਚ ਬਹਿ ਜਾਂਦੀ ਹੈ, ਜਿਹਦੇ ਕਰਕੇ ਆਪਾਂ ਨਸ਼ਾ ਵੱਧ ਤੋਂ ਵੱਧ ਕਰਨ ਲੱਗ ਪੈਂਦੇ ਹਾਂ। ਪਰ ਅੱਜ ਦਾ ਦਿਨ ਮੈਂ ਇਹ ਚੀਜ਼ ਕਰਦਾ, ਮੈਂ ਕਾਉਂਸਲਿੰਗ ਕਰੀ ਹੈ, ਜਿਹਦੇ ਕਰਕੇ ਮੈਂ ਅੱਜ ਦਾ ਦਿਨ ਨਸ਼ੇ ਤੋਂ ਦੂਰ ਹਾਂ। ਅਤੇ ਕਾਉਂਸਲਿੰਗ ਨੇ ਮੇਰੀ ਬਹੁਤ ਜ਼ਿਆਦਾ ਮਦਦ ਕਰੀ ਹੈ, ਇਸ ਦਾ ਮੈਂ ਬਹੁਤ ਧੰਨਵਾਦ ਕਰਦਾ ਕਾਉਂਸਲਿੰਗ ਦਾ। ਅਤੇ ਬਾਕੀ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਦੋਸਤੋ।
Welcome back again. And now, before we bring our two very special guests, I would like to welcome Dr. Sujoy Ray on our show again. He has been with us for the past 10 episodes. And we all know that Dr. Sujoy is a clinician, he is a psychiatrist, he's a researcher, and we are so proud and we are so honored to have him on our show. Please welcome Dr. Sujoy, and thank you for coming. Now I would like to invite the two very special guests who will share their thoughts and experiences on our topic that we are talking about. Indeed, they are very strong, resilient, and brave individuals who have graced us with their presence to share their personal stories. So We Serve Canada is very, very grateful to have been given this opportunity to provide a platform for youths to have a voice within the community. Please welcome Asta and Monica, the sisters of the gentleman whose video you all had watched a few moments ago. Welcome, Monica, and welcome, Asta.
Hi, I had a husband who was addicted to alcohol and drugs, and he had a gambling addiction as well. So it was really, at first I didn't know because I didn't come from the family where we had seen these type of problems in family. My father never drank like that, and we didn't have any issues. So for me, it was a really new experience, and it was heartbreaking to see a person going through this. Even if I was facing mental illness at that time as well, I didn't realize that because it was affecting me as well. And the Okay, so I have seen two people in my life, my brother and my ex-husband, having issues with the alcoholism and substance abuse. So, but I had two different perceptions because with my husband, I knew that he was drinking, so he had a issue. But with my brother, for couple of years we didn't know that he was having any issues with the problem because he wasn't drinking. He was just taking the other
The substance.
substances. So we couldn't read the signs. We didn't know what was happening to him, or he was getting farther and farther away from our family and me. But with my husband, it was easy to see the symptoms, and he needed help. I did try to help him. I went to the meetings with him. I tried to get him into a rehab, but the thing is, the system in India and system in Canada is really different. So in Canada, you need the consent from a person who is addicted, right? The family can't do anything until the person who is going to get into the program doesn't give the consent. But it was hard for him to come to the conditions, but it was affecting us really badly because he was drunk, and he will be at some random parking lot. I had to go and get him, or sometimes I'm receiving a call from a police station saying that, oh, he's in a drunk cell and you have to come and pick him up. He was in a fight, or sometimes I had to he did take me in. He was drunk, and I got into a car with my husband few times.
Monica, can I just interrupt
Yeah, sure.
1 second? Was
Yeah,
this
sure.
in Canada?
Yeah, this was happening in
Yes.
Canada. Yeah, so I was getting all these calls with my husband. It was stuff like that happening, and I was trying to get a help, but I didn't know much about how to tackle this. And I did try to go to rehab centers and get some information, but the thing was, they were saying if the person doesn't want to get treatment, we can't help you. And it was really hard to convince him that he needed help because he was drinking non-stop. It was okay, he will pass out and he will come into his senses, then he'll start drinking again. So I wouldn't know when to talk to him. But then I had to get a court issued order for him to just detox himself for 3 days and come into his senses and get some treatment, and also at least I could talk to him, so I could make him understand that, okay, this is happening, this is what is happening to you first, and then how is it affecting us, me and my mother-in-law, right? Because
Exactly.
I was working and I was supporting my in-laws family, and on top of that I was taking care of him. So things like that, I didn't have any support at that time, and I didn't know that I could get any support. Like I knew that he needed help, he can get support, but I didn't know any of this, that I could get the help I needed to support his disease. How could I help him? I didn't any, and nobody actually. I did go to so many different places to get help for him, but they didn't advise me that I can get help as well.
As
How
well.
to, yeah, how to help him. And at that time I didn't know any of that, but I did try to help him. I did convince him to go to a rehab for 3 months and stuff like that, but it kind of built up. And when he came back from the rehab, during the period he didn't talk to me because he thought I forced him to go into a rehab, and I told the family, and I kind of ruined his reputation, and he started blaming me for that during that period. So when he came back from the rehab, he's basically tried to kill me a couple of times. He tried that.
Oh my God.
Yeah. So
Oh,
the
gosh.
abuse was okay. He was there was some fights before if I tried to help him, but at that time it went to, because the buildup inside him, that I ruined his reputation, was that he just really wanted to get over
Take
me,
revenge or something like
take a
that.
revenge on me for doing that. But I did tell him afterwards that I didn't tell anybody. You started calling everybody for money, or stuff like that, that pick me up or stuff like that, and people started seeing what was happening. So I wasn't to be blamed, but he didn't want to listen at the time, because he was under influence and things like that happened. But I thought I was doing okay.
And
But
yeah, that was what my question was going to be. That how, I mean, obviously your mental health must have been at
it
like a
has
dramatic level. So like,
for 8 months.
how were you able to face the challenges? How were you able to deal with these situations in such traumatic times?
At that time, I was trying to be brave for my family, and for myself as well. But I didn't have any support or anything like that, because I thought I don't need it, because he's the one who is sick. He's the one who is going through stuff. I didn't realize that I needed to take care of myself as well. And the things happened with us, and for longest time, I think we were together here for 10 months, which was and then he went to the rehab. Then after he came back, then the thing with this happened, the assault happened, and the police came in, and they separated us. So we got separated, and afterwards, then I didn't sleep for straight 10 months. I never used to eat anything or like that, and I never realized that I was doing this to myself as well. And when I got separated, then I started realizing these things, that it affected me badly as well, because I couldn't go to sleep. I had nightmares, even if I go to sleep for an hour, because I was tired from working all the time to support myself. And then I started seeing the symptoms. It took me a long time to realize that, but then I went to my doctor, my physician. I told her that, okay, so this happened because I lost a lot of weight at that time, and then I couldn't eat, I couldn't sleep, and I went to my doctor and said that, oh, I can sleep. And she said, what's happening in your life? And she started telling me, and she said, do you know that you can get help too? You need the support as well. You don't have anybody here. I didn't have, at that time, I didn't have any family. My sister came 4 years ago, but the time I was talking about, it was approximately 8 years ago. So I didn't have any support. Then my doctor tried to help me. She sent me to a couple of one group meetings for domestic abuse victims, and I didn't know that I was being abused because I never realized that I was being affected as well.
Right.
And she made me realize that I have PTSD and I need to see somebody, otherwise it will get bad. And I did go to, at that time, I did try to go to a couple of meetings individually. There are some and one group meetings on weekends, but it was really hard for me to go because of the work. I was trying to support my son. I was working 6 days and I couldn't keep up. And then I thought, okay, I will get better. I went to India and come back, and then I kind of stopped. And but then there's the time when came I couldn't even get out of my bed. I won't even wanted to talk to my family. Even if I talk to them, I will get into fights, and stuff like that started to happen. And then I realized that I needed help, and it was affecting me. And then I started going to a therapist through my doctor's help, and they arranged me for free therapy and group sessions and started to take care of myself. But it took me more than 4 years to realize that I needed help as well. Not him. Because I couldn't see that, okay, he needed help. I could see with my husband, and I tried to get him help, but I didn't know that, because in India we don't know what is mental health. It's not a priority. If you talk about, oh, I'm depressed or I have anxiety issues, I remember seeing on TV, and I remember seeing that if I won't get out of my bed, or my mother used to have depression, we never understood that because nobody knew that she had depression, and she still has. Sometimes she will won't get out of bed. And then when I started going to my therapy session, then I realized, and my therapist said that you had a problem. And then he told me about these things. Then I started to see, but we never saw that in our family. So how could I, see for myself that I was having issues? And so, yeah, with him, I was going under really mental scrutiny, and I was under pressure to keep both families together. And he was going through as well too much, my ex-husband. But for him, I knew what to do. But when this happened to my brother in India, I didn't know what to do, because the issues I faced over there with my family was that they didn't want to send him to a rehab.
Okay.
And they didn't know what was happening to him. They didn't actually understand properly that he needed to get out of that environment to get healthy and think about for himself. And for longest time they tried to get him a medication, just the medication to improve himself, and there was no support system for him. We tried to support him, but the family in India, the relatives and stuff, and the options he had, the people can get him the drugs to our home. And stuff like that was happening, and we couldn't realize for a couple of years with our brother. We didn't realize this, that it was happening. We saw some symptoms. Some change in his behavior. He wasn't we wasn't talking to us that much, or sometimes he will be in a zone or something like that. But because we never had that sort of substance abuse, we never saw that. We only saw alcoholism in some families, or in something happened with me. I didn't know that, but with our brother, we didn't realize that this was happening until it got too late for him to, get the help he wanted to, because at that time he could get help easily. He didn't share because he knew that he was shameful. I think he was ashamed of himself or stuff like that. He wouldn't be able to share. And the thing is, the with families, with our family or any other family in India, it's really hard to share. We can share a good news, we can share our achievements, but we can share if we are doing something wrong with our families. So
Yeah.
there is not that kind of openness with us. And even if he tried to share something, he won't be able to. He will start crying even if I started to ask him things like that. And the day we realized that it was going to really bad, we heard from a couple of his friends that okay, he's not doing really well. They tried to inform us, and the family didn't take it well, and they didn't get him the help. So thing is, I knew a lot of things that he needed, but I was not able to get that from my family for him, that
Right.
type of help, until it got really late in the time. So I just wanted to know that there are two situations, Dr. Sajai, I described. With here, there's them. But in India, a lot of youth, especially in Punjab, there are no jobs. They are staying at home. They don't have anything to offer to their family. The families are spending too much money on the education, but they don't have anything to, go with the things that they can do. And staying at home makes them experiment with these things, and they get depressed, and they go out with friends, and the friends who are already taking these things, they will offer, and they get addicted. Once or twice they take it, and then they feel good, but then until it gets really hard even for them to realize that. And for my family, because the hardest thing for us was we couldn't see what was happening to him. So these were the issues we faced with the both, like
Both the scenarios, those were the two issues. Yeah.
two issues.
No,
but
Monica, thank you
totally
so
different,
much
yeah.
for
Yeah.
elaborating and telling us your personal stories.
Yeah.
I think what we are going to do is that we have some questions from Astha.
Yeah.
And it is more reflective of from your brother's point of view and the youth.
Yes.
So why don't you ask those questions to Dr. Sujoy, and he might be able to give a better understanding or better way of dealing with it. So maybe you can ask the questions, Astha. And then we can move on back to Monica for some of her questions.
Hi. So I do have couple of questions with the person who is going under the substance abuse, particularly about there are so many people who are going through the same situation, particularly in Punjab. Like every other person in Punjab is addicted to substance abuse, whether it's any kind of, it's a medical, we can say, or either it's opioids or any other substances. So the first question which I would like to ask is, what can how can we help those people who are more vulnerable to these kind of things? Like how can we aware them?
So thank you for that question. And well, I mean, as far as people who are vulnerable to this, the thing is almost anybody can be vulnerable to substance use. There isn't really a particular demographic. Unfortunately, it is now affecting all ages. But yes, there are some people who are more vulnerable, as was being mentioned earlier by Monica ji, that the job issue, the unemployment issues make the person more vulnerable to substance use. I think the important thing is to see what is making them vulnerable. So if we can identify a particular area, so like a person would turn to substance use for usually into one, either when sort of bored and he has nothing to do and they want a new kick or some new thing to experiment and try, as was being mentioned earlier, or they will turn to substance use to what should I say, dampen or decrease their uh, problem. If they have some stresses in their family, if they have some depression, even simple things, you have medical problems or mental health problems, so people turn to substance use to help them to sleep, help them to reduce the pain. So the important thing is to find out what is making the person vulnerable. There are many factors, there may be more than one, and then they have to be addressed. Those particular factors has to be addressed. Like if it is a health problem, it needs to be addressed. If it's a mental health problem, it needs to be addressed by a psychiatrist. Money related issues, unemployment need to be addressed by it depends. Unemployment and social issues are an overall responsibility of family, government, individual, the people who are around the person in the society. So we have to find out what is it that is making them vulnerable, because otherwise, even if you do treat the substance use and that particular factor remains, the person is going, I'm not saying everybody will come back, but he's likely to come back to substance use. And at the same time, we must sit with the person and encourage and talk to him, because a lot of time people feel that they are not being heard, they are not being spoken to. So if you speak to the person, address his concerns, and at least they feel that they have a voice to listen, they have a ear to listen, which is listening to their voice, then it makes them less likely to turn towards substance use, less likely to turn towards other new things to experiment, because if they perceive they are getting support from the society and individuals, they'll be happy about it. Nobody really wants to get into substance use. Once it's just that once they're into it, then there is no going back, and it turns them into totally different people.
Okay. So the other question is, like, what kind of support can we provide to those people?
So the support that you can do is it's at the various levels, as I was mentioning earlier. So if the person's, let's say the main issue with the person is a physical health problem, he doesn't get sleep, and there is a danger that he might turn to alcohol, then he must see a doctor and find out how his sleep problem can be treated. If it is a depression, the person is sad, person is not well, or any other mental health illness, anxiety or anything like that, he must see a psychiatrist. If the issue is within the family, then yes, the family needs to get together and talk with each other. I'm not saying all cases, but some cases, things like family therapists, counselors, they're always there to help. And the issue is that you should not feel ashamed of seeking help from him. That stigma should not be there. So, if things like sleep or things like depression, things like really bad problems in the family, nobody expects people to turn into doctors and treat them themselves. So, whatever is the issue, accordingly seek help from them. And that is how you can help. That is how you will ultimately address the cause, and you must stay with the person and encourage him or her to say that we are with you, we know that you're suffering from this. Let's say if the person has already started taking things like alcohol, cigarettes, or whatever it is, then to tell the person that look, this is, you have to be very careful about it. You must make it clear to the person that this is a dangerous thing, this will only ruin your health, but not to blame him, to help him understand that yes, we know why you have to turn to this, and rest assured we will help you. So that kind of a combination will eventually help the person. So this is a very intensive, work. It needs involvement of family, society, friends, employers at the workplace need to be understanding. Those kinds of things are there. So if everybody works together, then the likelihood is that the outcome will be better.
So the other question would be like how we can create awareness so that they can talk about this openly, very openly.
Yeah, so awareness again, it can be created at multiple levels. There is no really, there is no really fixed rule where it should begin. It's some basic things in schools. There can be talks on substance use because it is now affecting even younger children, younger generation people. Simple things. Of course, psychiatrists, doctors, they can come forward and do sessions, or now in the online world, people can do talks which everybody can access. Access. But even other things come. It depends who the people listen to. Community leaders, elder people. It could be anybody. So whoever has the leadership role, it can be local level or city level or whatever it is. whoever has a leadership role, whoever is a respected figure in that particular community, whom people listen to, so that person can do it at the community level, and families can do it at their level. The person in the family who is the head, or may not be the head, but somebody whom everyone listens to, they can talk about these things. So very basic things: what substance use is, why do people turn to it, common types of substances which are used, what are the symptoms, how to get help, simple, what are the helpline numbers. There are helpline numbers from different places for different countries, regions. So all these things should be told, so that if the person knows in the beginning itself that yes, there is something called a substance use, these are particular things which are harmful, this is what makes us vulnerable, so he or she will be on the lookout that, if he finds that, he's developing symptoms of depression, or he's or she is developing is becoming prone to take drugs and alcohol, then that person will immediately come and tell their respective family or friends. And that is another thing, you need to tell them very clearly that, look, if you feel you have a problem with drugs, or if you feel that you could get into drugs, please, this is the phone number you should contact, this is the person you should contact. Confidentiality should be ensured in these cases. It depends. Different people are comfortable talking to different people, so we should have channels for everyone. So that is how we can help them.
Okay. And the last question which I would like to ask, it is basically a common question. So if a person is open to get a treatment, what kind of treatment he or she should take? Like in India, basically the rehab centers which I am talking about is, I have researched so many things about Punjab. I'm particularly talking about Punjab. The government rehab centers are actually very poor. They don't treat them. They usually take them for 15 days. They just give them some medicine. They don't take care of anything, and they just discharge them. And the result for that is that they particularly went back and then come to that situation, and in the end they end up in taking substance again for their situation, because they are not getting proper help, which is, because in this situation I think the mental support and the financial, sometimes it is a kind of situation where people don't afford a good rehab where everything is giving to them, the food, their mental support, psychiatrists are taking care of everything, which everyone cannot support. So what would be the actual structure of a treatment which people need to take to get out of this situation, if something is on their early stage or in their mid stage or in their last stage of these things?
So any drug addiction treatment follows some basic principles. So as you said, it depends on which stage the person comes.
Yeah.
Let's say, for example, a person has come in a stage which is a very bad stage. So let's say a person who's already addicted to alcohol. I'm just using alcohol as an example. There could be other drugs also. And one fine day, suddenly he misses his daily drink of alcohol, and he comes in shaking, and there are some symptoms, shaking and not sleeping and sweating and those kinds of things. So if that person comes in, first thing that person needs is a medical help. So it's just like admitting, usually they will admit in a hospital, even on an OPD basis, it could be very difficult to treat that person. They admit in a hospital, give certain medications in correct dosages under the supervision of nursing staff, if whatever other ward related staff, and treat him full the time. It could be 7 days, 10 days, till that that emergency phase is over, the shaking and restlessness is over, and also give treatment for coexisting medical conditions. So if the liver is bad, you treat for that. If the lungs are bad, treat for that. So a person who's come in that state would need some sort of medical help. So that should be given in a hospital, not only a psychiatric hospital, some hospital which has a lot of medical facilities. Now, if it's a person who has come at a very early stage, that he himself reports, he comes and says that, look, I know, Dr. Saab, that I could get prone to taking alcohol because I feel that I am needing it, but he is not in that bad a state that he's shaking all over and not sleeping. So maybe he needs some dose of medication and he'll need counseling. Then there could be a person or family who comes in saying that we have stresses in our lives. I have difficulty in sleeping. I have not yet touched alcohol. I have not yet touched cigarette, but there is a big chance I may resort to them. So then they should be treated based on their particular condition. So again, if a doctor will assess them or a psychiatrist assesses them and finds out that what he has is proper depression, so they'll give them treatment for depression. Treatment for depression could be medication, it could be counseling, and also treatment for the family. So couple counseling, family counseling, whatever it is. And again, as I said, there are some issues, there are some things like financial issues and all which doctors will not be able to solve. So again, the employer, the society has to cooperate and maybe give them proper leaves, adjust their salary. Certain things can be done. So that is how you can. An ideal de-addiction program or an ideal way to help a person would be to first see which stage he is in, he or she is in, and accordingly intervene. So this is what we do in the initial stages or in the mid stages, and in the very late stages, which we call as rehabilitation, when the person is off medications, off drugs, and you need to send it back to society. So that transition should not be very fast. So because if he suddenly comes back to society after say 5 days in hospital, and then again he faces the same stresses and he'll turn back to the drugs, that will not make any sense. So there is certain specific counseling which is given to what we call as coping skills to help to cope with the stresses. That अभी तो आपको problem हुआ, but later on if you face the same stress again in your life, instead of alcohol, how do you deal with it in a healthy way? So that is psychological counseling. Different people take different times. There is nothing to worry about it. And also for those people who will have difficulty in going back to work, they could they could be helped with physiotherapy, occupational therapy, basic things. And also to make sure to tell them again what I was saying earlier, that again if you face a problem, which phone number you should contact, whom you should come back to, and what channel you should approach. So an ideal drug de-addiction program or a way to help a person in an ideal way would be this. Now all facilities will not have everything, so this is something in which everyone has to work together, government, people, employers, family, and they all have to come together in this, and they have to find that what is lacking in one aspect will have to be taken care of in other aspects. So if a collaborative effect is there, usually people will have a very good outcome.
Yes. And no, I think that was a great set of questions, Asta, and thank you so much for those answers as well, Dr. Sujoy. I'm going to pass it on again to Monica because I know you also had some very specific questions that maybe with your experiences. So feel free to ask Dr. Sujoy right now.
Yeah, Dr. Sujoy, so the first question of for me is, I dealt with my two type of different addictions and two different type of people who had expressing feelings, right? How to detect, first question is how to detect the early on symptoms and try and get them to feel comfortable to get help, and because that's the stage, even if when we know that okay something is wrong, but they don't want to commit this to the getting better because they're saying, oh, we have things under control. So how to get the help at that time for them and try to stay.
I understand. So that is another thing we need to be very careful of. So I mean, in case of early warning signs, if you see, it sometimes becomes quite clear. Like people don't sleep properly well. They appear to have some issues themselves. They would withdraw from other things. They would not do things which they usually enjoy doing. They may come back home late at night. You may find some other evidence of alcohol use or cigarettes or things like that. So it becomes quite obvious to the person who's living. If you know that particular person, you can detect a change in their routine. Or detect a change in what they have become in terms of physical as well as mental health. I think the best thing to do is to not to be judgmental, because if you straight away confront a person, even if you are suspecting or even if you think that substance use is a problem with the person, and if you straight away confront, then they will tend to become defensive. They have, as I was saying earlier, people resort to substance use because they already are experiencing some kind of stress in their life, and they want to get rid of it. And now if somebody is confrontational with them, or somebody directly encounters them or something like that, then it will become even more difficult for them. it will become an added stress on top of this. So the important thing is to first find out what is it that is bothering them. Sit with them and ask them. I mean, you have to make yourself clear that yes, you have detected such changes. You are seeing that this person is not the same as he or she used to be, and then ask them what's the problem, what's going on. They may deny it in the beginning, but the issue, how you have to convey it to them, is that you are asking them because you're not here to judge them. You're not here to tell them anything. You can promise them not to be angry with them. That just I'm asking this to you because I care for you. I am your sister, mother, daughter, son, whatever. So that they should get that particular message. And there will always, again, in a family, there will be somebody, that a particular person may be attached more to his mother, maybe attached more to his sister or father, whatever. And if it sometimes happens, so they would be sharing more of their secrets with that particular individual. So if that individual comes and talks to them, they will feel better. Of course, any member of the family can talk, but if there is some sort of a special, it will help. And once you establish, that is the first step. So if that step is done, they will usually tell you, at least if not about the substance, they'll at least tell you the problem that they are facing, whether it is the financial issue, whether it is the physical issue, and then you can advise them what to do. Of course, you don't have to solve all problems yourself. There are doctors, there are counselors, and as I was saying earlier, regarding substance use, regarding the exact problem of the substance, as you rightly said, that they may say that everything is all right, and they may insist that the alcohol or substance is actually helping them keep them under control. Now, this is a mindset that will only change if there is intensive education. As I was saying earlier, there should be education at the very basic level. So if a school going child himself knows about the harmful effects of substances earlier on in his life, when he grows up in his adulthood, he will never think that alcohol is okay and I have it under control, because he will have had that education. And if somebody does not know that, it is important to make them know. Now here is where the psychiatrists come in, because what basically doctors do, we have a basic rule. We don't ever confront the patient, or we don't argue with the patient. We simply take their blood samples, we do the blood test, and then we show the report to them कि भाई आपको ये problem है, ये देखिए. So it's not, we are not saying, it's like we are not saying that the substance or the alcohol is causing you problem. Your blood report is saying this. Your blood report is showing that your liver is like this, your stomach is like this, and from that point, and we try to make them show a connection. If they have previous reports which were normal, previous to when they were using drugs, we try to make them show the connection that, look, now you have two sets of reports. One was normal, one is abnormal, and you know that the abnormal one has come right after you started using your drugs. What do you think? Then they will understand. This is how doctors should deal with it. I mean, the family has to just help them to get to the doctor. And once they see that discrepancy, then they understand. Yes, it takes time, but they understand that yes, this substance is doing me harm, and I am not. Unfortunately, it is not helping me.
Yeah.
Yeah. Okay. So the second is,
So basically, I think your question, Monica, is that if somebody who has been, he has come back to normal, and if
and then
you
what's
think
that?
that they are resorting to these small symptoms that you are able to
Yeah.
pick up, you want to just make sure that how can you trust them fully when they say that no, everything is fine.
Everything is fine, and you
Okay.
know that something is different again, right?
So
Yes.
unfortunately, the issue with substance use is that what we call as relapse or reuse of the substance.
Yes.
It's not an exception; it's a rule. Substance use is a disorder which comes again and again. What I was saying earlier on is that this depends on the type of the rehabilitation program the person has had. So before he is discharged back into the society, he should be taught, certain skills. That if you were, let's say, for example, if a person is drinking because of stress, every time he faces a stressful situation, he drinks. So if a psychologist or anybody, a social worker or psychiatrist, any member of the family teaches him how to deal with stress. Now, how to deal with stress can be anything. It could be a breathing exercise, it could be a talking exercise, it could be anything. So how to deal with that particular situation which is making you drink. So if that education is given to the person, that is the actual treatment. So, I mean, it's not so much about trust. It's more about saying that, how do we tackle the problem at the root? Because as I was saying earlier, the problem originated because of a certain reason, because the person has depression, because the person cannot deal with stress. So how, if we teach the person how to deal with stress, if we treat the physical illness, if we treat the depression, if we treat the family issue, how teach the family how to support him, then he will not turn to drink or drugs because there is no reason for him. So that needs to be addressed, and that is one of the characteristic of a good de-addiction program, that it should not neglect the rehabilitation or skill teaching part which comes after the medical treatment is over. And if you feel again that after all the things that the person is again going back into drugs, you have to start the same procedure again you have to be non-judgmental, encourage him or her, and then take him back to the doctor. I mean, no doctor or no psychiatrist will refuse you just saying that I've treated him once and I'm not going to treat him again, because they know that relapse or reuse is the rule. And unfortunately, it's happened to many people who've gone in and out, but that's how it is. And it's all right. It depends. The next treatment should be even more powerful than the previous treatment, and then gradually the person will make progress.
And I got one more question. So, how can we make sure for the person who is coming from the rehab or who's coming from the treatments, that how can we maintain, how can the family, spouse, or the family parents, we can make sure that he's getting the support he needs, because we are not sure as a family that what he needs or what he so yeah, basically the environment which he will be able to fit in, because he or she might be living in a rehab or in a disciplined environment, and he has a routine over there. But when you are coming back to civilization or a family setting, it's going to be disrupted, for quite some reasons. So how can we make sure, how can we accommodate the person?
So this is a joint thing. First thing is that the person himself has to learn to cope with the problem. So he cannot stay in rehab for the rest of his life. Someday he has to come back to the real world, isn't it? And he'll face stresses over there. He'll face stresses all over his life, all through his life, and he has to learn to how to handle those stress. So if it is, let's say, it's peer pressure, it's his colleagues or fellow students or something like that who are forcing him to drink, he has to learn the skill. He has to use the skill to say no. He has to learn the skill of refusal, and he has to apply it himself. What the family can do is to be with him, and because if he once, let's say he the problem is with refusing drinks from his friends, and he says no, and then he feels bad, and he feels guilty. Yes. Why did I say no? That time the family needs to come in and remind him that you're doing this for your health, not because you're cracking up the friendship or anything. So when the person is trying to apply those skills, you need to be supportive to him or her, and just to be with him, make sure that he is applying his skills, he is doing his best, and give him encouragement. Even a person who's known to be drinking every day and comes back from the rehab and goes without does not drink for 3 days, then that that needs to be appreciated. So whatever the good things he is able to do, even if he is able to stay off the drink 1 day, and then there is no problem, then he is able to stay off the drink for 2 days, 3 days, 4 days. So the more praise he gets, the more that praise will feed back into him. So just make sure that you are helping him apply his skills and praising him for what it is, and that should be all right.
Okay. So the very last question for the evening from myself is, I know that the road to recovery is really long and it needs patience to be dealt with, and what we can do to help ourselves if we find in a situation that they need a guidance, we can provide that. But for mentally prepare ourselves to deal with a situation like that, what should we do and what should be doing to help them as well in that kind of situation if we see the things like that?
So any good de-addiction program will always involve the family. So the psychiatrist or therapist or whoever whoever is treating the person, will also speak to the family, and usually, they all the conversations and all those things, they will happen together. So some things might be confidential. There is always a doctor-patient confidentiality. So but otherwise, when they are teaching the person skills, and when they're teaching what I was saying earlier, that they're teaching the person that how the drug is affecting their body, they'll make the family sit with them. And basically, what the family has to do is to reinforce that belief in the reinforce that understanding in the person. They have to tell him that, look, we are not being judgmental with you. We are not, trying to sort of reduce your freedom. We are just repeating to you, look what the doctor has said. He's clearly told you, and you have understood that very well. That alcohol affects your liver. So alcohol affects your livers, your stomach, and smoking affects your lungs. So those facts which have been already clarified by the doctor, you have to remind the person in a sensitive kind of a way. And how to do that, you'll learn it once you have a session with the doctor and the whole of the and your loved one and the whole of the family. But if you feel that you are not capable of it, or you yourself are stressed out, you don't have to take up the whole responsibility. There are other support communities. There are ex-drug users. There is Alcoholics Anonymous. People who had used alcohol and other drugs. They get together. So they all get together, and the people who were ex-drug users, they tell about the drug users who currently just come back about the effects of it. So it's not necessary that only the family member has to do everything, because family member has to earn, has to look after other family members as well. So it's not that you have to do it all by yourself. You can use the society's help, but in very simple terms, you just have to keep reinforcing the value of reinforcing what the doctor has said earlier. Unfortunately, as I said, there is no perfect way to do this. That's why, again, the transition from the rehabilitation or the hospital to the society should be very gradual. And as gradual as it is, it will be easier for the person to adjust.
So, thank you, Dr. Sujai. That's all.
Okay, all right. Thank you so much, Monica and Asta, for sharing your such personal stories. And it's sad that you had to go through these things, but I'm so grateful for Dr. Sujoy for participating and also giving that insight, that expertise as to how we can deal with these things. And like you so rightfully said, that all these things are available, it's all there, but you really have to reinforce yourself. You have to have the awareness of how you can deal with these things. So from this whole thing that I found for myself, like how do you deal with stress is really the most important thing for any and everyone, whether it is somebody who is actually going through any of the drug issues or addiction issues or mental health issues, or people who are actually fine and healthy too. So for me, people, when they are keeping themselves physically fit, they're going to exercises and they're doing things. So I think the time is here that we have to start taking care of our mental health. We have to start doing things that we can do to take care of our stresses. So I really like the way that Dr. Sujoy said that in each one's stress, how to deal with it could be very different. It could be the breathing exercises, it could be the yoga everyone says, but it really is pranayam, which is the breathing exercises, which is what kind of calms you down. For somebody it might be painting, for somebody it might be dancing, for someone it might be music. So everyone has to really find their own ways of dealing with stress, and of course keep themselves mentally healthy. So I definitely feel that. My only thing is that one thing that out of this whole conversation that I felt, when the stress is more, I guess, financial, and maybe it is a little bit out of your control, that is a little difficult situation, and that's when you really need the help of the society and other people. And that sort of thing happens a lot in India, and because of the poverty levels and things like that. So that is the reason why we are hosting this program. Like, our goal with this community talk today really is not only to raise awareness about the drug issues, but also to save the youth and the families from this vicious circle of, getting into this bad company or, drug addiction or whatever that is. So anybody who is actually hearing this, and if they think that they need help, definitely we will be giving our website, we will be doing different things where we can actually help you all. So you should reach out to an email to our website, and we will try our best to make sure that how we can help the people who don't have access to these facilities, or maybe they are not able to because of the financial situations and things like that. And we are blessed to be living in a country where we have all that in Canada. So we would like to help you all, anybody who is hearing this and anybody who needs help. So please reach out to us. And thank you once again, all of you, for participating in this wonderful episode of how we can deal with our stresses, really, and overcome our addiction problems and things like that. So thank you so much.
Thank you
for
for
participating.
Thank you so much
Thanks a lot
for giving.